At Des Moines University Clinic, you'll find healthcare professionals with only one priority: you, the patient. Come see us for the very best in family medicine, physical therapy, podiatric medicine, and osteopathic manual medicine. Call today to schedule an appointment.
Hey everyone, thanks for joining us. My name is Kaya Veldman. I'm a second year DO student here at DMU. I'm also president of the Preventative Medicine Club. We're going to give you a talk today on nutrition and staying healthy, as well as preventing disease before it happens. I hope you enjoy it. There are a few changes that happen to our body as we age. Our body's nutritional needs change, and eating nutritional food is important to maintain our weight and to stay energized. We also become more susceptible to certain chronic health conditions, such as type 2 diabetes, high blood pressure, high cholesterol, and osteoporosis. Lifestyle modifications, including a well-balanced diet and exercise, can help manage and lower the risk of developing chronic conditions. It has been estimated that up to a third of cancers are related to overweight or obesity, physical inactivity, and poor nutrition. Here we have a nice visual on some of the lifestyle modifications that are recommended to stay healthy and to prevent chronic disease as well as cancer. We're going to talk about a few of these today, including being physically active, eating a diet rich in whole grains, vegetables, fruit, and beans, limiting consumption of fast foods and other processed foods, limiting consumption of red meat and processed meat. We're also going to talk about supplements and how those are not always recommended. And from here, we're going to go and talk about diet. Like we talked about on the last slide, we would like to focus on nutrient-rich foods to obtain vitamins, minerals, protein, carbohydrates, and fats that our bodies need. Here we have a guideline on a healthy plate. So we'd like to fill half the plate with a non-starchy vegetable. So that could be spinach, broccoli, mushrooms, green beans, onions, anything in that vegetable category. And a tip is if you buy frozen vegetables, those are a great low cost and sustainable option. They have all the nutrients you need and you don't have to worry about them going bad. And then fill a fourth of your plate with a healthy grain or starchy vegetable. So that could be brown rice, as we see in the picture here. It could be sweet potatoes, oats, whole grain bread, or pastas. And the last fourth of our plate we want to fill with a lean protein. So a rotisserie chicken is a great, convenient option. That could be turkey. It could also be black beans or any type of bean. And another tip is to try to limit your deli meats. Those are high in sodium. And then we'd like to cut down on red meat intake as well. And then as an option, you can always add fruit, a salad, or an ounce of nuts for some extra protein and fat. And like we said, we kind of want to avoid the processed foods and the fast foods and focus more on a whole food based diet.
A common question amongst the general population is, do I need supplements? Eating a well-balanced diet is enough to provide you with the nutrients you need. If you are not getting enough vitamins and minerals, your doctor may recommend you a supplement. If you are over 50, oftentimes calcium, vitamin D, vitamin B6, and vitamin B12 are recommended. As we age, we get bone loss, which can lead to fractures in older men and women. Taking calcium or vitamin D supplements if you are not getting enough in your diet can help keep your bones strong. On this slide are just some examples of foods that have good sources of calcium, vitamin D, vitamin B6, and vitamin B12 in them. It would be good to try to incorporate these foods into your diet. So foods high in calcium are milk and milk products or dark green leafy vegetables such as kale. Foods that have a lot of vitamin D include fatty fish and vitamin D fortified milk. Vitamin B6 is found in potatoes, bananas, and chicken breasts, and then vitamin B12 in fortified cereal. While taking dietary supplements, it is always very important to tell your doctor exactly what you are taking. The FDA does not regulate supplements as they are not considered medications. Adverse risks can occur with medications that you may already be taking. A common medication that many people take is warfarin. It is important not to eat grapefruit or drink grapefruit juice while on warfarin, as it decreases your body's ability to metabolize the drug.
Exercise is one of the most important things you can do to stay healthy and decrease your risk of cardiovascular disease, diabetes, and hypertension. Exercise is not only helpful to prevent disease, but also helpful to prevent the worsening of diseases. The hardest part about exercising for all ages is starting to do so. But remember that any exercise is better than being inactive. It is important to do something that you enjoy and that is not difficult on your body. Things such as brisk walking, swimming, and biking can be a fun and a good way to get aerobic exercise. The CDC recommends 150 minutes per week of aerobic exercise. These are things such as running, walking, biking, swimming. For adults, 65 years of age or older. Know your limitations though. If you are beginning to find it difficult to keep up with your activities, scale back what you are doing or choose an exercise that is not as vigorous. Swimming can be very easy on the joints and is a popular aerobic exercise. The most important part about choosing an exercise to do weekly is choosing something that you enjoy. It can be hard to begin to work out, but this may be easier if you start a walking group with friends or family. You can also walk to your favorite coffee shop or your favorite restaurant instead of driving there. The pace should be leisurely. You should be able to talk while you're doing your walking. All of these things, although they may seem small at first, will make a huge difference in your everyday health, especially if you keep up the habits. You may also want to incorporate strength training. This includes lifting weights, home body workouts, and resistant band strength workouts, which we'll talk about in the next slide. It is important to have a discussion though with your primary care doctor if you are making any major lifestyle changes, just so that they're on the same page and can offer any recommendations or also any concerns. I think that using resistance bands are a great way to incorporate strength training into your weekly exercise. Resistance bands are cheap and can be done anywhere, so they are perfect for today in COVID-19 with social distancing. Here is a resistance band that you can carry with you and you can use in different areas in your house or at work just for a quick workout and to incorporate strength training into your workout regime. Make sure while performing these exercises though that you have a safe place to complete them and you can keep your balance. I included 3 different examples in the bottom of the slide that can be a good place to start. There are also many resources that offer different resistant band training programs and different workout groups that meet.
So guys, I thought it would be really helpful if I was able to show you how to do some of these resistance bands that we'll describe in the previous slide. So remember, before doing any type of exercise that's outside of your normal lifestyle, consult your primary care physician and also make sure you have a good area to work with and be able to keep your balance at all times. Those are definitely the most important things to consider when starting a new exercise, and in this case, resistance band training. So the first exercise is going to be the chest press, and you want to have your arms in a comfortable, grab the resistance band comfortably, and your arms in a comfortable position right outside your chest, and then just bring your arms out as so. Really able to feel that stretch in your arms. You can do this as many times as you want. So the next stretch is called the leg press. For this one, you should be sitting down and be in a sturdy chair and also be able to have good back support and also have your balance. You want to put your leg into the resistance band and have a good support on it, and grab your arms at a 90-degree angle in front of the chair, and then push your leg out. Remembering to keep your balance at all times. The last stretch is the lateral arm raise. And for this, you would stand on the resistance band as if it was a jump rope and you have your rope underneath it, making sure to have your resistance band in the middle of your feet so it doesn't get pulled from underneath. And maintain your balance and pull your arms up as much as you can. And those are the stretches described in the previous slide, and I hope this was able to help you if you wanted to try these at home.
If you would like to receive a free resistance band and sample exercises so you can try these out for yourself, please send your name and mailing address to jacob.d.hamilton@dmu.edu and we'll send one over to you. Thanks again for watching our presentation, and we hope that you learned something.
Des Moines University Radiology offers imaging services to our patients and outside referrals. In addition to traditional x-rays, we offer state-of-the-art imaging technologies for measuring bone mineral density and body mass composition. One of the imaging services in high demand is body composition analysis, or BCA. Our simple scan measures a person's total body fat composition as well as the ratio of lean mass to fat mass in each arm and leg, the head, and trunk. If you want to stay in good health, this will provide you with a detailed analysis of your body, including measurements of true body fat percentage, ratio of fat to lean tissue, and color-coded body mapping. Because BCA analysis is considered the gold standard in measuring the body composition, people often use the information when planning a workout routine, changing diet, or making a lifestyle makeover. Too much fat can lead to serious health problems like heart disease, diabetes, and joint disorders. Measuring body composition provides a more accurate picture of your overall health than simply stepping on a scale or calculating your body mass index. Many older adults use BCA to keep track of their body fat ratio and markers for obesity. Scans only take a few minutes and use less radiation than you would receive on a commercial flight. One short, simple scan provides a wealth of valuable information about your health. You can map your lean, fat, and bone mass, see real body fat percentage, and identify your risk for metabolic diseases by measuring your visceral adipose tissue. That's the fat on the inside around your organs, not the muffin top that you can pinch. It's a fast and low-cost process that does not require a doctor's order, and results are available the same day. We invite you to take a new look at your health.